Hi, Casey here with Welllife ABQ. I just wanted to go over how we save people money. And those people can be individuals that sign up for membership here at the clinic, or they can be businesses that are level funded or partially self-funded. There's some different terms for that, but ultimately the company pays for claims that come through, and the goal is to remove those claims because they get wildly inflated and move them over into a different column at sometimes pretty massive discounts. So here's an example of what we do when we're going to prescribe a medication. And so I have a patient that is needing liquid carafate, and carafate's a medication for the stomach, and the doctor had recommended oral suspension, and it comes in 420 mLs. And so I looked at it from an aspect of whether we can order it for her, see if we could get it cheaper, and it doesn't look like we can. It looks like our best price is going to be $165, and she can get the same thing for about $76, $80. So in this case, we would not be the preferred way to get this medication. So we do that all the time, and sometimes that story's swapped, and we are the better route for the medication. And so in this case, we would tell the patient, print out a coupon of GoodRx and go to the pharmacy, and this will be your out-of-pocket cost. The problem, although $76 by itself is a pretty expensive per month medication, she's actually going to need about 1,200. She's going to need about 3 bottles. So that's like a $225 situation. So we discussed it, and there's a tablet option, and you have to dissolve the tablet. It's actually pretty easy. It's a 4 times a day medication, so you need 120 tablets. And that looks like it gets you at about $24. And then if we look over here at what the clinic can get, we're looking at 100 tablets, so not quite enough, or we could look at 500 tablets, and we can get it for 500 tablets for about $87. And so 500 tablets, so this is definitely probably the better deal. And if this person were part of a company and they were paying for her medications after the third-party administrator claims process, and individuals, people that are patients, they don't really understand that this is actually going into a pile of money at their company and being withdrawn from there. And so this would be the better option. It would save the company money over the GoodRx costs, but the truth really is probably this is going to be inflated in the insurance claims process to maybe, especially 500 tablets, let's do something more reasonable, 100 tablets, so $20, you're going to probably pay as a company easily, $120 probably. Maybe you'll get a discount, you'll pay $80, when ultimately you as the company could have paid around $20 for that same medication, same amount, same everything. And the employee would have had, possibly, depending on how you structured your program with us, they would have had even less out of pocket, maybe even zero, depending on how you wanted to cover medications. And so we do recommend that companies that are considering this program to definitely cover 100% of the membership, and then to look at covering a significant portion of medications and labs, just like they would if there was going to be an insurance claim. You're just shifting the costs over into another column. You're still covering partially. The patient has less out of pocket, your employee has less out of pocket, and you're paying less. Everybody wins. And the employee doesn't really know any different. All they know is there's out of pocket because they're going to be paying us directly for their piece, and then we bill the company for their piece. And so it's really a smooth process. It sounds a little complicated, and it's hard to explain because it's a complete paradigm shift of what is currently the status quo and how routine healthcare is managed. And that's our vision here at Welllife ABQ, is to really change the face of primary healthcare and what it looks like to everybody, individuals and companies. So again, this is KC with Welllife ABQ. Thanks for listening.